Hello, everybody. Welcome to Coronavirus API, the Coronavirus Tracking and Actionable Insights site for this current pandemic and beyond. Next slide, please. We have a big problem. What we don't know can hurt us, and what we do know can save us. And part of the problem is governments are required to report data. And once they do, it comes in a form that is often used in a paper form. It's not aggregated, it's not easy to use, and it's not standard. So what we do is create an automated scraping and normalizing of that data. We provide it in an anchored fashion, in a way that's transparent, and we add analytics and insights so that you can manage the risk. Next slide, please. So as we said before, states and territories and counties are on the front lines of what has to be done regarding this pandemic. They must acquire the data and they must display the data. But there is no way, absent our site, to aggregate that official data and put it in some standard form that makes it easily accessible. And once it's accessible, it's easily actionable. So we've created a very transparent system that tracks the spread of coronavirus and provides this data to everybody who needs it. Next slide, please. You can see who uses this data today. It is designed for doctors, nurses, public health professionals, researchers, academics, and government users. It's been live since March 8th in its rudimentary beta form. It has potential beyond the initial use for public health. There is commercialization potential in insurance modeling, risk forecasting, economic projections. We certainly know about supply chain fragility. This can help with that. And we also understand that certain sensitive populations are impacted more than others, and the demographic that will be reported and recorded on this will become quite actionable. And because we are anchoring this data and making it transparent, we will have archival functionality of the data sets. Next slide, please. So what does data look like without our site? These are shots of actual pages of different states. They're static sites that show you counts that you can access yourself, but you have to likely pull down the analysis through some kind of a paper type or screenshot. Not easy to use. The data is reliable because it is public health reported, but it is definitely not actionable. Next slide, please. We make the data actionable. Our crawler puts that data in a uniform form. You can see that in our chart. And then we create some basic analytics for this. You could see this, suppose you're in a state that has a response that is similar to a highly infected state. You can then predict out how your state might react. It's extremely useful to figure out your use cases on this and take different states and compare. Next slide, please. George, up to you.
Hi, everyone. So this is George. What I wanted to go over with you is exactly what we've increased in the functionality. As Susan said, this has been a project that's been live since March. One of the big things is that the crawls and parses are much more automated now. That allows the archiving and the anchoring to happen on a more regular basis. We also now have a checkpoint system via smart contract. Our website is live, and you can see it at coronavirusapi.com. Next slide. The next step is we're looking to build dashboards. Dashboards will help because it'll allow people to see the archival data. It'll allow people to trust in that archival data, because what's going to be happening is as the various scrapes of these websites are hashed, those unique hashes will then be embedded, and people will be able to look back in time to see that this was what was publicly available by trusted sources on these dates. Also, the data dashboard that we're building out, it will also include map views. As it exists in its current form, many of the state and county websites' map views are done in formats that aren't easily accessible, and certainly not in a manner that allows you to compare between counties or states or cities. This will allow you to do that, as well as something that Susan's already mentioned, which is importantly look at what's happening in particularly affected demographic populations. We know, for example, of the African American communities being really hit hard by the COVID-19 epidemic, and having data on what's occurred in one state versus another with those populations will be very, very helpful. Next slide, please. This shows you a timeline of where we are today. It shows you what we had worked on prior to the hackathon, what we've been working on during the hackathon, and for our next steps and milestones, as I've already outlined, we've talked about the need for the dashboard to continue to be built out. Next slide, please. And this is the fun slide. Here's a list of everyone who's been involved with this since the beginning and all the contributors during the hackathon. There's also some other people who prefer to go nameless, who aren't listed here, but we're really happy with all the support that this project has received and all the attention it's been getting from insurance companies and academics and universities and even government officials who are looking at our data. So we're really happy about this, and we're proud of a transparency project like this during this crisis. Thank you.